Okay, so you're in charge. You and Gwen will work it out. Okay. I want to take all that stuff right now. I get
with Gwen Azama-Edwards every Thursday at 6:15 on Volusia Radio. Gwen Azama-Edwards, retired city clerk, former city commissioner, city of Daytona Beach. The Truth with Gwen Azama-Edwards on Volusia Radio.
And you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, you got it, power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access all of those powerful resource listings with links to municipalities, government agencies that are not only your municipalities, but your county agencies, state agencies, federal agencies, and your advocacy groups. I want you to go there too so you can chime in on the survey that we have going. And this will probably be the last week for that, where I'm asking you what you think about government employees who are retiring on your dime, so to speak, but they're making a heck of a lot more than you are. What do you think? Go to the website, www.gwen-truth.com, so you can access that survey and give me your input. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach, and president CEO of AE Enterprises, Inc., a consulting firm on politics and ethics. We have a great, great, great show for you tonight because I'm going to, along with three great friends who are here, help to educate you or update you in terms of HIV, AIDS, and we want you to be powerful, we want you to be informed, we want you to be able to not only educate yourself but also educate others around you and that you come in contact with, because it is possible, we are believing that it is possible that one day we will have a land that is free of AIDS, and we need to dispel a lot of the stereotypes that are associated with it, as well as any feelings and mistreatments that any of you might have in regards to persons who have AIDS. Okay, so that's our goal for tonight, and you know that I've had this subject before you previously, and I will continue to do so until we are free of it. Amen. I got to put my amen in there, okay? All right, all right, all right. Do want to go do a shout out to all the bikers that are in the area, and reminding all of you to really, really, really look out for the bikers. And also to say to the bikers, because I've almost hit 2 or 3 of you, look out for us too, okay? When you're just dotting in and out and you're not caring about, you know, trying to be safe or whatever, and we're trying to be, but you're not, that doesn't help you, it doesn't help us, okay? So work with us as we work with you to try to ensure that you have a safe and enjoyable time during Bike Week. Also got to do a shout out for H.H. Gregg. I don't do this very often, but we bought a large screen TV from them, and you know, we had some service issues, and I will tell you that they just bent over backwards to keep us happy, to make sure that we were happy. So I'm going to do a shout out for them and to them, H.H. Gregg. You know that they're in Daytona Beach, and they're a great company that's been around for a long, long time, and they are desirous of serving you and making you happy and keeping you happy. And we know, I just found this out, so I'm going to just say to you guys, you know that Easter is occurring in March. It's March 31st, so all of you are preparing for that great and awesome holiday. Just know that it is coming earlier, okay? Now, let's get to the program, because this is a great program, a great informative program, and whether you are a person who has AIDS, or you know someone who has AIDS, or you just want to be better informed. And I just pray that that is your desire as you listen in tonight to tonight's program, because we have three wonderful guests tonight. We've got Jeff Allen, who is the founder of Positive Champions Speakers Bureau. And you need to, if you're interested in having someone come and speak to you in regards to AIDS, you need to make sure that you make note of his number and the website that we're going to give you as we go through the program. His partner, Omar Mays, and I say partner in terms of the fact that he's with him in terms of the Speakers Bureau, and he's also with Jeff too in terms of the HIV campaign that they have going, that is going on. And really, if you have not already seen this exhibit, it's too late for this area, but maybe you want to go further south as it's made available. The Faces of HIV campaign, that exhibit that's going on. And we have someone, as we've had him before, Patrick Foran, and he's going to correct me, I'm sure, if I mispronounce his name, because I had the problem the last time, right, Patrick?
That's right.
With the Volusia, Florida Department of Health. And he's going to make sure that he tells you about an AIDS conference that's going on. So these are my guests, and since we've got three of them, and usually when I have, 2 or 3 guests, I kind of sit back and just let them kind of take over and share. Because that's what this program is about, empowering you. And we're empowering you with information that will help you to not only help yourself, but help others, and then that helps the community. All right? Okay. Wonderful. Now, I suppose that we'll start with maybe Patrick.
Sure.
Start with you, and then we go from you, and then however, Omar didn't get to meet you. Came in a little later, and Jeff, they have great information that they want to share as well. So we want to make sure, again, that as much as we can cover in this hour or so, that we do so. So welcome to each and every one of you, Patrick, Jeff, and Omar. Okay.
So, well, I guess we'll go ahead and first talk a little bit about what's going on currently. There's, as you said, Gwen, there has been a lot going on with HIV here in the community. We were very fortunate to have the Faces of HIV campaign come into Daytona Beach with stops at Daytona State College, as well as Bethune-Cookman, and over at the African American Museum of Arts in DeLand. This is a statewide campaign that was funded through the Florida Department of Health that really highlighted what it's like for a person that has HIV and their life, how they live for a month. They chronicled that by taking like a daily journal and writing down what it's like for that month that they lived with HIV, their daily medication regimen, how they feel in the morning, just what it's like to live with HIV. And then they also documented that in a documentary in front of the camera that was a part of this exhibit. Now, of course, if you didn't get a chance to see the exhibit, it's also online at wemakethechange.com.
Oh, wonderful, wonderful.
So anybody can go to that website, and you can click on the Faces of HIV link, and you can see Jeff and Omar and about 15 to 18 of their close friends now, because they were all involved with this, their stories. And I'm going to defer to Jeff and Omar, since they have that personal experience as being a part of this campaign.
Well, it was an eye-opener for me. Thank you for having us here today, Gwen. Being a part of the Faces of HIV, after living with the disease for 28 years, you would think it just became an everyday thing for me. But after I spent 30 days doing the journal and looking back at what I wrote within the 30 days, I realized how much my life had changed that I didn't even realize. And I was able to bond with people like Omar, that was also in the campaign, and learn from their experiences as well. How about you, Omar?
Well, I think that it kind of puts a mirror up to your face about our disease isn't something that we always keep to the forefront of our minds. And so to help people to realize just because we look healthy doesn't mean that there's nothing going on inside. And we just have to be very diligent about our health care. you know, and we just want people to treat us just like they would anyone else, you know, with any type of disorder.
I can recall when Patrick was on the show previously, and this is something that's confidential information, so people don't know who has AIDS, who does not have AIDS. So in the workplace, they actually could be sitting right next to a person who has AIDS, but that's not something to be fearful of. You know, you can think of, you sit next to people who may have cancer, you have sit next to people who may have other types of illnesses or whatever, and just as with those individuals, there's medication in the life that they're taking, this is the case with AIDS as well.
Exactly.
And I would think as this was chronicled, and hopefully it was maybe even over the years, as we think of AIDS, we think back to the way it was many years ago, where people did not live as long with AIDS as you have,
Right.
Jeff. And you think about what's the show that was on Philadelphia?
You're right.
Yes, yes, which really kind of set in place a lot about, I guess, what AIDS victims were going through at the time. But that is really old history now, I would
Well,
think.
it set the tone. It set the tone for a new way of talking about HIV. And the Faces of HIV campaign did just that. It put a face to HIV, and it's dispelling the myths. You know, you can't tell who has HIV. So years ago, when people had HIV, you know, they looked kind of sickly. That's not the case anymore. People are living longer. They're living much healthier lives. And you can't tell just by looking at someone. So that's the whole point in putting a face to HIV. It's not something you can see. It can happen to your brother, your mother, your cousin, your uncle.
It's like we would say, which the word says, it's not a respecter of person. So babies get it transmitted through their parents. We got, you know, the elderly who, Patrick, as we were talking earlier, who are not taking the precautions necessary.
Correct.
You know, they're just having free sex and having a good old time.
That's right.
And not doing the protections that they would be doing were they in their 30s, 40s, or whatever.
Or even asking the right questions of their partners.
Right. And Patrick will talk a little bit about this, but I mean, for 22 years, in the African American population, it's been the leading cause of death between the ages of 25 and 44. That's phenomenal.
Yes.
We need to stop that.
I think
Speak to
20%, more than 20% of women that are African American are more likely than white Americans, white women, to get HIV and AIDS. And that has a lot to do with the disparities in the communities about there is very little education at all. Condom use, women speaking up about their own sexual health and taking ownership of that is creating this perpetuating cycle. You know, you have these black men that are going into jails in and out, or they're just sleeping with some of the same people, and in that community, because of all these disparities, they're not asking the right questions, they're not protecting themselves, so that's why there's this high increase in African American.
And used to, you know, people would assume that if you were having an HIV test, they would assume that you were homosexual. Well, that's not the case anymore. I mean, just because you're having an HIV test means that you're taking care of your health.
Absolutely, absolutely, because heterosexuals are getting, you know, from other heterosexuals,
Exactly. Right.
and young people are getting it, and then they're spreading it to other young people.
Exactly.
So we've got this kind of a two-edged sword that's going on in our community, and as you said, you know, it's got to stop.
Right.
It's got to stop, and it stops through education,
Right.
and it stops through people caring about themselves and caring about other people. Wouldn't you say?
I definitely would say.
Well,
And go ahead.
Well, I was going to say, well, that and 20% of the people that are positive don't know that they're positive. So you've got a good majority of the population out there that don't get tested, that need to get tested because they are positive and they just don't realize that they're positive. So 20% of the population are the cause as to why we continually see new cases of HIV come into the community. Because those 20% don't go and get tested on any sort of basis, not just a regular basis, but they don't get tested at all. So they don't know that they're positive, and they continue their promiscuous lifestyle and not using protection with their partners.
And you have people who are taking, they're getting physicals every year and the like, and this is not something that's normally tested, is it?
No, but as recommended, you can always ask your doctor when you go in to have your annual lab work done, can you throw in an HIV test too? It's not any more blood that's going to be drawn from your body. They're just going to reserve a little bit that's left over for the HIV test.
And when we talk about asking, they don't ask the right questions. What are the right questions to ask?
Maybe when was the last time you were tested, or have you ever been tested for HIV or AIDS?
Are you protecting yourself when you're having sex?
Or how many sexual partners do you have?
We need to ask the question of why can't we have frank, open discussions within our schools and our school children? Because until you change the perception within the youth, it's not going to change. We need to increase youth involvement in all HIV community activities and get them involved.
Is there, does your Department of State, actually go into the schools and provide information? Are you allowed even to do that?
No, that's just it. The school board is a part of the school system, obviously, and they're the ones that set what is discussed within the school day, and that's one item that we defer to them for, and they make those decisions. So no, we are not in the schools, and that's really out of the Department of Health's hands.
But we're trying. The Positive Champions, which is a speakers bureau that we've created here in Daytona Beach. It's called the Positive Champions Speakers Bureau, www.positivechampions.org. We go out and do presentations. Omar has created some great presentations that can be presented in front of youth. You don't have to talk graphically about sex to teach kids about how to protect themselves in sexual matter. And we will go out anywhere we're invited. We want to go out to the schools. We want to have these discussions with these youth.
And it's important that it goes on. It really and truly is. And I know that a part of the concern is, as you've mentioned, that they think you're talking about sex. What the parents need to own up to is the fact that the kids are going to hear about it one way or the other. Not necessarily those things that they need to hear, but the other side of it that they don't want them to hear.
But look at our youth. I mean, they're changing the bully policies that are happening across the nation. I mean, it's the youth that are going to change the face of this country. We need to focus on them.
Oh, absolutely. And I can remember in high school where we were told about, I mentioned this to you guys earlier, gonorrhea, syphilis, and all of that stuff. Our teachers taught us about that. They taught about the signs to look for and all of that type of thing. To me, that's, this is just as important as those things, and I guess they've probably taken all of that out too.
Yeah, I'm not sure what's covered in the health education within the school system, but just general knowledge about sexually transmitted diseases, and HIV is a sexually transmitted disease. Should be covered on a basic level. But again, I'm not sure what is in the school system, and that's for them to to set the direction as to what should be taught within the schools.
Now, if a parent though wants their child to be informed about this, they can go to the website. They can go to
They can call up the health
Department.
department. Yes.
Right.
Yes.
But if they want to, without contacting you all, just go to they could go to the website maybe, and there's some information they can actually sit there with their child and go through.
Of course, there are numerous websites. You've got the CDC has ample amounts of information about HIV and AIDS on their websites, and it's got good educational information as well. There's AIDShealth.org. There's The Body, Act Up Against AIDS. There's many different websites that have great information and very accurate and frank information as well about HIV, its transmissibility, how easy it is to actually become positive if you're not paying attention to what you're doing, and just continually to look out for that information because it's there. It's
Mhm.
there and it's easily accessible.
And the website, the Florida Department of Health of Volusia County website, has a plethora of information, as
Mhm.
well as the Positive Champions website. And the We Make the Change website has links to all types of different websites where you can get different levels of information. So
Mhm.
you can pick and choose as a parent and go through the information and decide what you want to go through with your child, and just have a conversation with your kids.
Well, I think that was more of the mission and the goal for Jeff creating the Positive Champion Speakers Bureau is because we did not have an end to the school system.
Mhm.
And what we have found is through some of our community partners, churches, and different organizations, that we have found a way where we can talk to some of these youth and some of these younger parents, because this information is not getting to them on any level. Social media has changed the face of how information is traveling, and so we want to be able to reach our youth in the way that they communicate, you know, whether it be on Facebook, whether it be on Twitter. And so we're kind of moving our efforts in that way because we don't want these kids to miss out. You know, you're talking about sexual health or sexual activity begins between the age of 13 and 24. You know, those age ranges. Well, that's
And
middle
some
age.
I've heard even younger than that.
Well, that's, you know, that is middle school to college age kids. And could you imagine receiving an HIV diagnosis in that age range? The maturity level isn't there. There are no coping skills. You know, it can be something that's very, very tough for the person as a, an individual, and for the family to be able to deal with that, because people don't have all of the information.
Well, in talking about, families and education, coming up here in Volusia County, we do have that opportunity in Daytona Beach, because on March 30th, we've got a conference over at the Bethune-Cookman University School of Nursing, the L. Gale Lemeron School of Nursing building. It's going to be a conference for men, for women, for families to come in, talk about and learn more about HIV and AIDS. We're going to have presentations by Jeff and the Speakers Bureau, I believe.
Yes.
As well as other concerned individuals that have a lot of information about HIV, and you can come out and you can listen. There's a website that we can register you at on minorityaidsnetwork.com. There's going to be food that's going to be provided for lunches free, and it's going to be, it starts at 9 and goes to 1. It's almost a day-long educational series on HIV and AIDS for men, women, families, whomever wants to come out.
And what's the date and the day of the week that is?
That's going to be Saturday, March 30th. That's the day
great.
before Easter.
All right.
Over there at Bethune-Cookman. Free lunch, and we're asking everybody to please register at the website minorityaidsnetwork.com.
And the address, in case you don't know, is 739 West International Speedway Boulevard. And we have a great keynote speaker, which is Renee Ladybird Burgess. And she has a powerful story that she's going to share. She was married and was in what she thought was a monogamous relationship, and got the virus from her partner when he knew that he was positive and did not tell her. It's a powerful, powerful story. It can happen to anyone.
And that is across from the Civic Engagement Center, directly across the street from that. In terms of the chronicling of a day in the life of someone with AIDS, and I know it's changed, as we started out saying, dramatically from the way it used to be, 20, probably even 10 years ago. But what are some key or highlights of your day in terms of being a person who does have AIDS? And does it include, because what we've seen in, you're stereotyped by what's shown on television. Where they say there's a lot of medication that you're taking, from the time you get up to the time you go to bed, and all of this type of thing. And that, you know, people have the stereotypes too that they can get AIDS by, you know, just touching somebody with it and all of that. There's just a great fear out there that that people need to pretty much, I'll just say, get over. So, chronicle, you know, a little of the highlights of that, of either of you or both, and then, you know, let's hit on some of the stereotypes too that are out there, that things that just aren't true.
Well, for me, I'm very fortunate. I'm on a 1 pill a day regimen for HIV.
Oh, wow.
And that's through nothing that I did, just the medications have gotten much better. I've only been positive for about 8 years, and I was on a 3 pill a day before and subsequently changed to make it a little easier for me. However, I do take mental health drugs, and those are because of the side effects of being HIV positive. So kind of take something to wake up, to kind of get me going, and something to go to sleep as well. So that's kind of the untalked about parts of, you know, being HIV positive. Sometimes there's a lot of lethargy. That is a symptom of being HIV positive. Sometimes we just push through those symptoms, you know, because we know that we have things that we like to do, that we want to do, or that we have obligated ourselves to do. But it is a reality for us. And me personally, I was very fortunate. My family knew when I was diagnosed and was very supportive. I never really had a lot of discrimination or fear close to me having HIV. People weren't afraid to drink after me or you know, use utensils or anything like that after me. But I can say that I have seen and I have heard. There are some horror stories out there that exist today like they did when HIV was just new. I was hospitalized when I was diagnosed, and health worker would not even bring me my food into the room because of the fear that maybe she had because she was pregnant. This isn't a normal, it's not something that normally happens, but it still does happen. People sometimes with HIV are treated a little not quite equal, you know, as other patients with other disorders, and that is, it's really sad, you know, because we want to get people in care and keep them in care.
Right.
So if you have these misconceptions or these myths going on with healthcare workers primarily, that may keep someone from staying in care.
And taking a trip to St. Augustine, taking a day trip to St. Augustine has to be planned. I have certain times that I have to take my medication. Used to, my medication had to be refrigerated, so I'd have to carry ice in a cooler, carry my medication in the trunk. So, you know, it all has to be planned out. A day in the life of the HIV, it can look just like everybody else's life, except for the fact I'm digging in my pocket for my pills. You know, it does, fatigue does play a major role in a lot of people's lives. The main thing about having HIV is if you know you have HIV, then you can take care of yourself. If you don't know that you have HIV, then you're putting yourself at risk for really deadly consequences. So getting tested is the answer to all that. The earlier that you're tested, the better your health care is going to be, and quite frankly, the less it's going to cost the state and the nation, because your health care is going to be under control.
How many pills do you take a day?
I'm on a 5 pill a day regimen, but I've had HIV for 28 years. And when I first went on medications, my adherence, my routine of taking the medication wasn't quite so good. So I became resistant to a lot of the drugs. So therefore I'm having to take more drugs than most.
What's the average number of drugs that someone actually...
It's going to vary. It depends on the individual. And like Jeff said, their resistance to the medications. One person newly diagnosed might not have any medication resistance. So they could be on a 1 pill a day or 2 pill a day regimen. Then again, someone that's been non-adherent or doesn't take their medications regularly could be resistant to almost every type of medication. So that means that the physician is going to have to keep trying different cocktails to check and see if they're on the best one. They're going to have to continually get blood tests done to check their viral load, or how much virus is in the blood, and also how many white blood cells they have in their system. Because the higher number of white blood cells and the lower number of virus in the blood is what you ideally want. So it's a very delicate balancing act that the physician must try and work through in conjunction with having a very compliant patient.
And when Omar talks about one pill, that's just because the drug manufacturers have gotten really good at combining drugs into one pill. Omar's taking more than one medication. It's just combined all in one pill.
Oh, okay.
It's 3. It's actually 3 pills.
3 in one?
Three drugs in one pill.
Right.
Oh,
Yes,
okay.
they've started to combine different types of medications into one pill to reduce the number of pills, to hopefully increase the likelihood that the patient will continue to take those medications on a regular schedule. Because that was one of the biggest issues back in the 90s that a lot of these patients had, was that they had to take 5 pills 3 times a day.
Right.
And 15 pills a day is an extremely high number of pills. But back then, the technology wasn't there in developing the medications to be able to combine them into one pill.
And I have to say that there are people who don't have HIV who are maybe elderly or whatever else, and they're on like a 15, 20 pill based upon whatever ailments they are. I know my mom at one time was taking 10 or 15 a day based on all of the different ailments that she was dealing with. So it's not, for those who think, oh, we got HIV, you do all these. That's true of a lot of different or illnesses or whatever that people have. So we would say to anybody listening who may have it or think or suspect that they have AIDS, that that type of thing can go on in almost any kind of a setting as far as the health of the person is concerned. So if you're taking a lot of pills and you end up slipping and saying that that's the case, that doesn't necessarily mean to the listener that, hey, that person has AIDS.
That's right.
Something else could be going on with them as well. When we look at the data in terms of what's happening with AIDS, and we had talked about the fact that there are seniors, that number is increasing because there are seniors who just, they're having a great sexual life, and, for that to be going on for some of them, could be new to them for years. They haven't had any, whatever. Let me keep it kind of up on that.
Okay, too much information.
Yeah, right. But all of a sudden, they're going all hog wild and not understanding that it's important for anybody, whether they have AIDS or not, to be very, very mindful, I'll say, very mindful of what it is that they're doing at all times when it comes to sexual encounters. And that's any age, any group, whatever. That's just important, because not just AIDS, but there are all kinds of sexually transmitted diseases that are out there. And when we think of, as I mentioned, gonorrhea, syphilis, and the like, there are some really, as bad as they were back then, they're even worse now, some of those sexually transmitted diseases. So people really need to be mindful of that and careful.
Oh, of course, because, again, these diseases have been around for a very long time. Okay, extremely long time. Chlamydia, gonorrhea, and syphilis. They've been around a lot longer than HIV has been around. So they've been treated for a lot longer than what HIV's been treated. So some of these sexually transmitted diseases are starting to become resistant to the normal medication that would cure or treat the disease. So a person could run into a very hard to treat strain of gonorrhea or chlamydia and not be able to kick it. Continually show signs and symptoms, and then combine that with if they become HIV positive. So their body is already trying to fight off the first STD. Now they get a second. Well, that's just going to deplete the bodies even more, because it's going to keep trying to fight those diseases. and the body gets weaker, and then you got to take more medications, and
The immune system is just.
it's just a vicious cycle that needs to be stopped. And one way to stop it is to not get there in the first place.
Exactly.
You know what your body is. You know where you've been. You know what you've done, but you don't know much or anything about the other person. That's when you need to ask the questions. That's when you need to be cognizant of what's going to take place and prepare yourself. That person might not be prepared, but if you prepare yourself and you bring protection and you maintain that protection is going to be used, then you're protecting yourself, and you don't get into that sticky situation.
Now we want to talk about, again, more of the stereotypes and the data, but we were talking about the fact that there are now some tests that they're selling where they say you can test yourself to see if you have AIDS and the like, and you were saying that they're pretty reliable. The problem is that what do you do once you find out that you test positive?
Yeah, that's exactly right. OraSure Technology has come out with an at-home test. You can go into any drugstore, purchase the tests, CVS, Walgreens, whatever drugstore you prefer, and the test is, I believe, between $40 and $60. It's a pretty quick test. It's an individual. All they have to do is swab their cheek with a little, with like a little toothpick, stick it in the vial, and then ship it off to the lab, and then the results will come back in about 2 to 3 weeks. Okay, but there's a couple problems with that. First off, I'm ecstatic that it's now available, because anybody who had any sort of reservation about getting tested in a public place, even at a doctor's office or at a local clinic,
Not trusting that it's
that's a public place, right? So they're unsure, or they don't want to be seen. Okay, so they can buy it and go home and take it. But the problem with that is, the first is, the person needs to follow the directions exactly. And the tests have already come out that the reliability of a person taking it home and doing it and following the instructions at about a 92% rate. So 92 out of 100 people will follow it perfectly. Those other 8 people are going to struggle. Whereas that same test that's performed at the health department or at one of our testing sites, 99% of the time it's going to be followed perfectly, because that's all those staff do. They test. They conduct HIV testing. So
and you were saying there's a cost for that, so it's not free, but is it right in line with what you'd pay if you went?
It's a lot cheaper. At the health department, it's $20 for a test. But if you go to one of our testing sites, like Outreach Community Care Network or Diggs Miracle, Stewart Marchman Act, through their mobile unit, it's free. It doesn't cost anything for the test. So there's a savings right there. And I know in these economic times, everybody's penny pinching, and $40 can put you a tank of gas if you got a small car.
Absolutely.
So there's a lot that can be done.
And there was a big debate about getting that test out to the public, and I was a big proponent for it, only because there are so many, mainly men, that don't want to go out to a testing site because they're going to be presumed homosexual. It's ridiculous to think that just because somebody's having an HIV test that they're homosexual. At this day and time, it's ignorance.
And I think, and one of the best ways that they can do that really is to have that test among other tests, because if what you're going out and there's a mobile unit and it's saying HIV testing, fewer people are going to go to that than somebody who can go, and there's a multitude of tests that are being taken in addition to that test. So people won't say, oh, see, he's got or she's got whatever.
But you know, when we were at Bethune-Cookman with the Faces of HIV, the mobile unit was there, right in front of the Faces of HIV mobile unit, and the students had no problem walking up and doing testing.
Young people are a little bit more.
I know, that's what I'm saying. They're going to change the face of HIV.
Absolutely, absolutely. And, you know, the truth is that with the older population, it doesn't have to be, we're not talking 50, 60, 80 even. We're talking people who are from 30 up. they don't want other people to know that they're being tested. They don't want other people to think, they even suspect that there could be a problem. So you almost have to, it's not playing games, but you almost have to be, you know, a little more creative in terms of the way that the tests are offered and given. So it's good they can go and get it on their own, but they can also go to the health department. And when you go to the health department, you don't necessarily go in there to have an AIDS test either. You go in there and all kinds of tests are offered.
All kinds of services.
And a flu shot. While you get your flu shot, you can also get tests or whatever else.
The great thing about going to the health department or to Outreach Community Care Network or DIGS or any of the other locations is once you have the tests done, then you can be guided in the right direction to maintain your health care after you know what the status is.
Right.
Right. I think the linkage to care is one of the largest barriers for a lot of people. And you're talking about someone doing a test at home as opposed to someone doing a test at the health department or at a service organization, is that they're going to miss out on something. Or there's going to be that fear, that overwhelming fear. And what we're also trying to do with our Positive Champion Speakers Bureau also is some way link HIV positive person with someone who's newly diagnosed, so that there is someone that they can talk to about their fears and maybe get some experience and, you know, strength and hope from that person, so that they know that they can live and have a great life. Because it doesn't start off very easily. You know, you're talking about someone's entire life is crumbling around them to come back from that, not only mentally but physically as well, because you don't know. You know, there's an incubation period. It's a lot of speculation about that, but that's just my personal belief about HIV and AIDS. And if you're not getting an early diagnosis, usually that person gets an AIDS diagnosis. It's the early diagnosis or AIDS diagnosis. There usually isn't very much in between there, you know, because people are presented with symptoms. They're not getting opportunistic infections until their immune system is so low, usually less than 200. You know, a healthy male's immune system is about 1,000, and a female's about 11 to 1,500. So you're talking about less than 200 T cells, helper cells in the body. That's quite a decrease. So, you know, we want people to be as healthy as possible when they come into care. If they have to come into care, we would like for them not to have to. But if so, we want them to be as healthy as possible.
Now, looking at the numbers, I have to say, boy, I see you get started, and before you know it, the time has flown by. You listen to Truth with Gwen Azama-Edwards. This is WLE 1380 AM on your radio dial, Goliath Radio in Ormond Beach, Florida. And my guests, as I mentioned, are Patrick. Did I destroy your name, Patrick?
You were close. It's 4N.
4N. Just like forehand, okay.
No H.
And I still won't get it right. The next and also Jeff Allen and Omar Mays, who are with the Positive Champion Speakers Bureau in terms of speakers for AIDS and or HIV-AIDS. And they are available, and we're going to make sure that we share that information in case you guys would be interested in having either Omar or Jeff, or actually even Patrick, come and speak to your group, or and maybe, you know, you as parents, you might want to pull some young people together so they can come and talk with them.
We'll come and talk to 3.
Yeah.
We'll come and talk to 1.
2 or more gathered in their name. Okay, wonderful. But there are, you know, there are stereotypes out there, but the data also tells its own story, because there was a decline in terms of people that are infected with HIV and AIDS, and now in some age groups it is going up.
Yes, it is. Well, we've already talked about medications, and in medications is why we're continually seeing actually increases in those individuals that are living with HIV/AIDS, because yes, they're living longer, they're getting diagnosed at an earlier stage of their disease for those people that actually go out and get tested. So the earlier they get tested and they get diagnosed, the quicker we can get them on the medications, which will ensure that they live a longer life. Because the medications, as Jeff can attest, are causing people to live longer, which is what we want. You know, we want them to live as healthy a life as they can for as long as they can.
I can say an amen to that.
Now, are the medications, are they available at a lower, reduced cost, or you're paying a whole bunch of money as, you know?
The medications
That
are
may be
quite
a
expensive.
stereotype.
Thank goodness there are programs out there available within our own community. There's a collaboration between the health department and the Health Planning Council of Northeast Florida and the Outreach Community Care Network, which is called the Partnership for Comprehensive HIV and AIDS Planning. And they do have programs out there that can help with the medications. They're expensive. They run about $2,000 to $2,400 a month on an average. So it's pretty phenomenal.
Yeah, that is.
So you definitely need to have insurance or help.
And that's why it's so important that if you're testing yourself, that you've got some kind of a link back to a program,
Absolutely,
because as you were saying, someone who is already walking that road can help that person in walking that road together, and help dispel any of the misgivings that they might have, or any of the situations where, because I would think that there probably are some people who think all of a sudden they know now that they have AIDS or HIV, and they're thinking, oh, my life is over. You know, there's no way I can afford whatever, and this, that, and the other. I may as well just end it. And we don't want people to think that, because as you're showing with 25 years of AIDS, and that's more and more the commonly what's happening, you can continue with your life. You can continue to have a fruitful and viable life.
Absolutely.
And
contribute to your community.
Yes, absolutely. And do that by getting not only the right information, but the right medication and that plan that will help to also enhance the life that you're able to live. And as you're saying, and your contributions to the community.
Yeah, exactly.
Yeah, I think a support system is very important, you know, for someone who's newly diagnosed. You know, family, friends, a case manager, you know, Medicaid nurse, all of those things are very important, especially in the beginning, because a lot of people don't have any idea how to navigate Medicaid or Medicare, or go to the health department and go about what does it all that entail, what information do they need to provide. They have no idea. They are in fear. They're, you know, walking in fear or shame or guilt, you know, so there needs to be some type of help for people, you know, and there is no shame about how you got HIV or AIDS. You know, there should be no shame about that. It should just matter, are you in care? That should be the most important thing.
And I guess that's what makes, Magic Johnson a very great role model, because if, in terms of the way he said he got it, et cetera, and the life that he's living, he's living proof that, you know, anybody can get it and still go on and carry on with a very vital and life and lifestyle. The data, though, as we were saying, does support that it is increasing with some age groups. Right?
Yes, it's unfortunate, but but like I had said, with 20% of the people not knowing that they're positive, we're going to continually see more diagnoses of HIV and AIDS. And yes, there are some populations, and there are subsets within those populations that we're seeing a greater increase, such as the men who have sex with men. That's a very large community of HIV positive individuals, and it's continuing to grow. And that's one area that prevention and education needs to be specifically targeted towards, so that we make sure that they know that it is prolific in the community, and they do need to protect themselves and know how to protect themselves and ask the right questions, and make sure that if they do go out and enjoy a couple of adult beverages, that they know to make the right choice after they've indulged in those beverages.
And we're not talking, we need to say too, about just homosexual men. We're talking about heterosexuals too, and down low, as they say, and all of that.
And can I speak to that?
Yeah.
Let me just call it like it is. Okay.
That's what we're about.
So we have a huge increase in the African American female heterosexual population. Why is that happening? Because the men that they have partnerships with are having sex with other men and not owning up to that, and then having sex with women, having unprotected sex with men, and then having sex with women. That's not okay. Partnerships are partnerships. Honesty and communication between one another is the only way we're going to battle this disease.
Absolutely, and that is telling it like it is. So any woman who suspects that her husband might be, let's just say it, messing around, as we say, you should march them to somewhere and get them tested.
Right. But
don't just,
if we're going to call it like it is, though, really all responsibility falls on ourselves. The women are responsible for going out and getting themselves tested as well.
Right, yes, absolutely. And if we're going to tell it like it is, this isn't just the men that's doing it, women are doing the same.
Exactly.
Having unprotected sex and bringing it back into the household.
Yes, ma'am.
So each individual has to take responsibility for taking care of their health, and ensuring too that not only are they tested, but they're ensuring that whatever partners they're involved with are tested as well.
Exactly. We just need to take responsibility for our own lives entirely.
Yes, absolutely. Absolutely. Now you had mentioned, I thought, that the 25-year-olds or something that's...
Well, there's, I've got plethora of data, okay? There's definitely no shortage of data when it comes to HIV and AIDS, and when looking through and just looking at specific information, like here in Florida, okay, we've been talking a lot about blacks. Well, for 22 years, so from 1988 to 2010, HIV has been the leading cause of death for blacks between the ages of 25 and 44 in Florida, okay, but since 2010, in 2010 and 2011, HIV dropped to the 4th leading cause of death among blacks.
Because we started talking about it.
And we started getting testing more frequently, so they started to get treated. And HIV was also the leading cause of death among black women between the ages of 25 to 44, but it dropped to 2nd in 2010 and 2011. So we're making headway by having discussions, by getting tested, by getting into the faith community.
I was just going to say that.
The faith community is key when targeting the black population, because that's where a lot of the African Americans go for strength.
But we have had a lot of inclusion from the faith community in our HIV
and that's
prevention.
Good. And that's important. It's important that it's happening, but it needs to continue more. And I'm sure you need more people as well.
It's got to be everywhere. That's just it. It's got to be everywhere. Where you work, live, and play. Education and awareness needs to be there.
And we can't have denial, trying to live in ignorance of what's going on around us, because that doesn't help you, it doesn't help your partner, it doesn't help your community as well.
Exactly right.
And we're lucky to have Patrick as our HIV and AIDS program coordinator. He's very involved, he gets people involved, and here he is, sitting a young man with a wife and children, and he's very active in HIV care in our community.
Yes, that's what Stephanie said when I said I want to have the speakers, and he's, Patrick's the right person.
Oh, yeah. He's the man.
Now, before we go off, though, let's talk about some of the stereotypes that are out there. There is a stereotype still that, if you touch a person with AIDS, you can get AIDS. If you eat after them, you can get AIDS. If you drink after them, you can get AIDS. How truthful is any of that?
It's not. That's just it. It's not truthful. So we're having a frank discussion. No, you cannot get AIDS by touching a doorknob, by flushing the toilet, by looking at somebody, by shaking their hand, by giving them a hug. You cannot transmit the virus that way. You can't even do it by a mosquito. Mosquitoes do not transmit the virus. Yes, they suck blood, but that's it.
Right.
They don't. The virus cannot live within the body of the mosquito.
You can't get it if I cough on you. You can't get it from drinking after me in a water glass.
Wow.
Well, let me talk about how HIV is spread.
Thank you.
Okay.
HIV spread. HIV is spread through needle sharing, breast milk, and sex. Those are the 3 major ways that HIV is spread.
Okay.
And make sure that's unprotected sex.
Yeah.
Or unprotected sex.
Unprotected sex, breastfeeding the mother to the child, and
Needle sharing.
sharing.
And there is one other way that is related to breastfeeding, but that's also during birth, or if a woman is pregnant and she is positive, the child can also get the disease during the pregnancy. If the mother is not treated or does not know that she's positive and she's not put on medication. And that's one of the easiest ways to prevent the disease going from mother to child, is if the mother knows that she's positive and she's on medications as early as possible within that pregnancy, and then the baby is immediately treated upon birth. And then we can get the transmissibility down to about 1% chance that the baby will be HIV positive after the first 6 to 9 months of life.
And I know there was some big article and story about the baby who started out being AIDS positive and then ended up, or HIV positive and ended up being without. You know, I guess they're thinking that it was some kind of a cure. Or is that something that you have? Go ahead, Jim.
It's been a hot button issue for us.
I think that's fabulous, and I think it's a great step in the right direction, but let's not jump ahead of ourselves. Just because this child has come back with a negative test right now does not mean that it's not going to surface. It could surface later. I've read all the documents, and I'm really excited about it. But let's get back to getting real. The only way to be hopeful is to be protecting yourself and others.
Right, because you don't want to be put in the predicament to have to think about a possible cure in the future.
Right.
Because if you don't engage in those risky behaviors, or if you protect yourself, then you don't have to worry about it.
And I don't want my nephew getting this disease. I have, 3 nephews. I don't want them getting this disease. I have frank conversations with them all the time. The more you talk about it, the more it's just commonplace.
Absolutely,
Well,
absolutely.
and one place that we're going to talk about it is on March 30th,
Right.
at the I Am My Brother's Sister's Keepers Conference that we talked about earlier over on the campus of Bethune-Cookman University at the School of Nursing. So that's one place that you can go and attend and listen to people talk about and have frank discussions about HIV and AIDS.
Right.
And make sure that you do register at the website, which is minorityaidsnetwork.com. And again, that's Saturday, March 30th from 9 a.m. to 1 p.m., the day before Easter, coming up here in a couple of weeks.
Absolutely. And, you don't just have to go if you suspect or you have HIV or AIDS. You can go as an interested community person or whatever else, so that you can help to share the factual information about AIDS and HIV. And it's just so key and so important that we all are informed, and that we help, again, to inform others. And I really do want you guys, Omar, Jeff, to share again your website and whatever other information that you can share as to how individuals can get in touch with you, and you or other speakers that are part of the Bureau can come to Speakers Bureau, can come out and actually talk to people. And then we'll end with Patrick sharing information as well about the Department of Health website, and I know he's available as well to share information.
Well, the name of our site is Positive Champion Speakers Bureau, and .org. You can go online if you would like to become a member. You do not have to be HIV positive to become a member of the Positive Champion Speakers Bureau. That is not, we don't discriminate. We need all the help that we can get. If you are HIV positive, you can, or negative, you can fill an application. If you would like for us to come and speak, there is also an application there, a request for speakers to come out. We have different speakers who, at different stages of their disease, heterosexual, gay people, it just doesn't matter, whatever type of speakers you want. Pretty much all of our information is on there. So if you'd like for us to come out and speak, we'll be happy to.
And we have, like Omar said, we have every population. We have women, men, heterosexual, homosexual, Latinos, white, African American, so we can accommodate any group. We're very grateful to the Health Planning Council for being our umbrella 501 nonprofit organization, and for AIDS United for funding us. They gave us a grant for the past 2 years, and it's really working out well. We're going out and speaking at Daytona State, Bethune-Cookman. We have quarterly events at all of those places, so it's really working out well. We work well with the health department and have an open line of communication with them. Omar talked about linking people with HIV positive people when they test positive. That was Patrick's idea from the Volusia County Health Department, or the Florida Department of Health in Volusia County. And you can call me direct. I throw my number out there and you're welcome to call it. It's 235-6796, and I'll answer any question you have.
Now repeat it again.
235-6796.
Okay, and that's Jeff Allen, and this is Omar Mays.
And my number is 386-295-4084.
And repeat it again.
386-295-4084.
I just find that when people start writing a number, they always miss something, and so it's great when they can hear it again. Anything else we haven't covered, Patrick, that you want us to cover? And then be sure to share the website for the Volusia Department of State, Department of Health.
I'll get it for you. I'll get it for you. Well, no, I think we've talked about a lot of great topics here tonight. We've really covered almost the entire spectrum of HIV and AIDS, and what we've been working on here locally, as well as what's going on at the statewide and even national levels. We do perform a lot of very good, hard work here. I know everyone that I work with is extremely passionate about getting the education and the knowledge out there, because again, we can lead the horse to water, but we can't make them drink. So, and by leading everybody, by providing that education, by providing that awareness, we then give you the power to make your own choice.
Absolutely.
And knowledge is power, and that's that's what these guys here provide, as well as the Florida Department of Health in Volusia County. And just to kind of sum everything up here, we are having a conference, like I've said over a couple of times over the last hour. It is on March 30th at the Bethune-Cookman University School of Nursing on 739 West International Speedway Boulevard. It's going to take place on Saturday, March 30th from 9 a.m. to 1 p.m. Jeff and Omar are going to be there with the Positive Champion Speakers Bureau. They're going to do a little skit that they've designed, and I'm excited to see it because I have yet to see it. Derek Henry, the mayor of Daytona Beach, is going to be there to give our opening ceremony and a quick discussion on his views as well. I'm going to talk about some of the statistics about how many people are infected here in Volusia County. How many people? How many men? How many women? The different subsets of the population that are affected and infected by HIV and AIDS.
Now you can give the subsets, but what is the number?
Well, right now we've got approximately 1,441 individuals living with HIV and AIDS. Okay, we see more blacks than whites in that, but the unfortunate part of that is the whites make up about 80% of the population, and blacks make up about 10 to 12% of the population. So right, with more blacks becoming infected, they're disproportionately affected because of the small number of population. Okay, and that's part of the education that we need to get out into the community. Is that yes, there are more whites that are infected, but look at the number of population. They might have 400,000 people that are white in the county, where there's only 85 to 90,000 blacks. You know, somewhere those are really broad estimates, but
so it's real disproportionate.
Exactly. Exactly. That's going to be talked about. We're going to have Lady Bird Burgess giving her personal story about how she became infected with HIV. It's a very moving story. And we've got another person, Janet Kitchens, coming from Positively You. It's a corporation or a nonprofit organization that specifically targets and reaches out to the positive community. So we've got a lot happening on March 30th. I'd love for as many people to come out, listen, see, learn as much as you can about HIV and AIDS. We have free lunch please register for the conference at minorityaidsnetwork.com. And if there's any questions about the conference or about what's going to happen, you can always call us at the health department at 386-274-0634. And again, that's 386-274-0634. And someone within my staff or even myself can answer your questions about the conference.
And give them your website, because I would think there's information there as well, right?
Yes, there is information at the minorityaidsnetwork.com. There's also HIV and AIDS information at wemakethechange.com or at volusia-health.org.
And we do want to mention, too, for those of you who saw the exhibit or those of you who didn't get a chance to see the exhibit, Faces of HIV-AIDS, that they did win an award.
Yes, yes, they won what's called an Addy. And that's a somewhat of a statewide campaign award for marketing, and now they're going to go up to the regional level to see how they do at the regional level. And I might be mistaken, but they could possibly progress on to a national award.
Awesome.
So the State Department.
And you guys were in that, right?
Yes,
you were a part of
yes,
it. So hey, applause, applause.
Yeah, if you go to wemakethechange.com, you'll see Omar's face.
Oh,
yes, it's
okay.
currently highlighted on the very front page of the website. I saw that today when I was on the website.
And you know, we're laughing and we're joking, but we all take this very seriously, and we do because we care about you, because we love you. We want to make sure that everyone takes care of themselves, takes that responsibility to take care of themselves, and that you're tested, you make sure your partner's tested, and you get informed so that you can, again, help to inform other people, and so the community is an even better place in which to live, work, and play.
And thank you for being so community-minded and
Well,
making this happen.
You're welcome, and thank you guys for being such great guests. I will have you back. Patrick knows that.
That's right.
We'll keep sharing the message and telling the message until everybody knows it. Okay, guys. Again, I'll be before you again before Easter, but have a happy Easter. Remember, it's 3/31, and the day before that is the AIDS conference across from the Civic Engagement Center on ISB, International Speedway Boulevard in Daytona Beach. That's 9 to 1. And you should also take part of that as well. Okay, remember to join us every Thursday starting at 6:15 until I boot the big guy out of the chair as we discuss issues to inform and empower y'all listeners. Also, be sure to go to the website, www.gwen-truth.com. Until next time, be informed, be empowered, and stand tall for that which is truthful. Again, this is Gwen Azama-Edwards with Truth Radio, and I'm still standing. I'm sure you're still standing. So is Jeff Allen still standing. So is Omar Mays still standing. Did I get that right? Yes, I did. And Patrick Foran. I got it wrong again.
Got it
Foran.
right.
No,
I did? Oh,
that was
wow.
good.
Okay, all right. We're all still standing. You guys be blessed and have a great weekend. Again, remember, look out for the bikers, and bikers, you look out for us. Be blessed. All right.
Great. Good job. Thank you.
Thank you all. And I have everyone's link, right? So I can